First of all, giving all praises to God, I am honored to be chosen to come to talk. I would like to give a special thank you to Ms. Terry Wilson-Gray with she's the Executive Director of the Bridge Breast Network. Also Ed and Pat Sanders, and I want to thank each of you for coming this morning. I want to thank Tim for introducing me, but many of you probably never seen me and never heard of me, but I'm what you call a screener. I work with programs. I'm the one on the back of the van, in the back of a building doing the exams. And my life has been dedicated to making sure people know what's going on with their bodies. In this particular presentation, which it will be 10 minutes, I got notes, but I know you guys are like, why she got all that? But I have 4 areas I'm going to talk about today is screening. What are the best methods and why? That's the first question. One of the things I have seen as a screener is that many communities in many populations, particularly the African American population, we don't know our family history. We're afraid to talk about it. We're afraid to say, hey, mom or dad, someone had cancer because it's one of those bad words in the family. I want people to be able to realize it's okay to say something to your family, to your children, to the young ones coming up, because they need to know what's going on in their family line. When you are looking at screening, you want to look at the risk factors. Like most cancers, age. The older we get, the higher the risk. And according to the American Cancer Society, women are 100% more time, have 100% times greater risk of getting breast cancer than men. Many of you probably don't realize men get breast cancer. Mm-hmm. Yeah. So you want to be familiar with your family history. Also, in looking at men, many people don't know one of the famous men that had breast cancer was Richard Roundtree. He had breast cancer, pretty advanced. When you look at the risk factors of breast cancer, you want to look at several factors in your family. And you want to look at, is there a woman in your family that has breast cancer? Have you been exposed to things that may increase your risk, like radiation? Also, one thing that is specific to men compared to women is that sometimes men in their teenage years get enlarged breasts. It puts you at a higher risk for breast cancer. Also, if people have been taking estrogen, and also if they have undescended testicles. And I talk about this because when I'm doing breast screenings on the back of somebody's vans, in somebody's church, I talk to people about their risk factors. The other thing with women and men is it's about knowing your body, getting the breast self-exams, also looking at your body, getting the physical exams, and also doing mammograms and biopsies if it's indicated. Now, my topic for today, which I didn't say, is breast cancer, where do you stand? So when you look at these factors, where do you stand in your family about the risk factors? And also, what can you do about increasing your knowledge about how high a risk are you? Now, my second question I'm going to address is discovery. Coming to grips with finding out you have cancer. Don't fight it alone. Organizations like the Bridge Network will help get you where you need to go if you don't have insurance. Oftentimes with the changing economics and the changing ability to get things paid for in our medical society, you want to get connected, stay connected.